Hello everyone. If you suspect a central nervous system infection like meningitis or encephalitis, at some point you will have to do a spinal tap with CSF analysis. And our main concern is to see whether the CSF profile fits one of the urgent and life-threatening conditions like bacterial meningitis that we need to recognize and treat right away. And the good news is, if you know what to look for, you can find out all you need in literally 5 seconds. Because there are 3 main elements to pay attention to in the CSF analysis: the cell count with differential, glucose concentration, and gram stain. In the end, I will mention some additional elements that can help you, but usually this will be more than enough. Now, in a normal cerebrospinal fluid, there are up to 5 cells per microliter per cubic millimeter. And all of these cells should be lymphocytes, so no neutrophils and obviously no blood, no RBCs. If there are more than 5 cells per microliter, there is some sort of inflammatory process going on in the central nervous system. And we want to know whether these cells are lymphocytes or neutrophils. Because if they are predominantly neutrophils, the first thing that comes to mind is, of course, bacterial meningitis. Bacterial infections of the central nervous system unleash a very violent, destructive inflammatory response with thousands, if not tens of thousands of neutrophils per microliter. It's not uncommon to see that the CSF literally turns into pus. You don't even need a microscope to see that right away. And in most cases of bacterial meningitis, this is exactly what you will see: extremely high neutrophils. However, there are some exceptions that you need to be aware of. In people over 50, people with unregulated diabetes, or especially people who are immunocompromised, one of the more common causes of bacterial meningitis is Listeria monocytogenes. And in meningitis caused by Listeria, oftentimes you will find less impressive pleocytosis. So instead of tens of thousands of neutrophils, you might find 1 to 2,000 cells, and not all of them will be neutrophils. But even with the most common causes of bacterial meningitis like pneumococcus or meningococcus, in some patients you might find deceptively low pleocytosis, especially the elderly and again, people who are immunocompromised. Why? Well, simply because their weak immune system will be unable to mount a very strong, violent inflammatory response to this infection. They will be overwhelmed with bacteria and their immune system will be basically defenseless. So you won't be able to miss the fact that they are seriously ill. They will be obviously septic, right? And in addition to this pleocytosis, there will be other elements in the CSF that will support the diagnosis of bacterial meningitis. The absolute cell count might not be that high, but these will still be predominantly neutrophils, and in addition to that, you will see low glucose. Please remember this is paramount. In almost all cases of bacterial meningitis, you will see abnormally low glucose. Now, in healthy, normal CSF, glucose concentration is about 60% of the glucose concentration in the blood. So for example, if the glucose concentration in the blood is around 5 micromoles per liter, in the CSF it should be above 3, right? And in bacterial meningitis, it's almost always below 40%. So again, if it's 5 in the blood, it should be below 2 in the CSF if we are dealing with bacterial meningitis. And this is why whenever we do a spinal tap, at the same time, we measure blood glucose. Otherwise, we wouldn't be able to calculate this ratio. But even if you are not very fond of math, glucose in bacterial meningitis will oftentimes be so low that you don't need to calculate anything. You will see that it's 0, literally 0, so no detectable glucose in the CSF. Again, this is typical for severe pneumococcal or meningococcal bacterial meningitis. Another thing that will be abnormal in the cerebrospinal fluid is protein concentration. It makes sense that with this violent inflammatory response, there will be all sorts of protein in the CSF, but this is relatively unspecific, so I won't talk much about that. Let's move to something a little bit more useful, like gram stain. If you work in a decent hospital, this should be done right away, meaning in less than, let's say, 20 minutes, you should know whether something is visible in the CSF, like gram-positive cocci or gram-negative cocci, gram-negative bacilli. And already this will give you a rough idea of what you are dealing with. Gram stain in bacterial meningitis is about 60 to 80% sensitive, which is good, but not perfect. Meaning, if it is positive, if there are bacteria visible, this is definitely bacterial meningitis. But if they are not visible, this does not exclude bacterial meningitis. Naturally, you will have to send a sample for culture, and in a few days you will get the definitive answer. Okay, so much for the typical findings in bacterial meningitis. But what if you find elevated lymphocytes? Well, this is where the story gets a little bit more complicated, but still, if you pay attention to only a few elements, you will do very well in practice. If you take a look at your textbooks and various tables online, you will see that elevated lymphocytes can be found in meningoencephalitis caused by enteroviruses, herpes viruses, arboviruses, Lyme disease, neurosyphilis, HIV, brucellosis, fungi, tuberculosis, autoimmune diseases, vasculitis. Let's try a different approach. If you suspect a central nervous system infection and you find elevated lymphocytes in the CSF, the most likely cause is some kind of a virus. But this is where the clinical presentation comes in. If your patient presented with signs and symptoms of pure meningitis, so no signs of encephalitis, the most likely cause is enterovirus. This is typically a benign, self-limited disease, unpleasant, yes, but self-limited with no long-term consequences. On the other hand, if your patient presented with symptoms of encephalitis, the most likely cause is herpes simplex virus 1. Why do I emphasize this? Well, if you suspect viral meningitis, pure meningitis, treatment will be symptomatic. If you suspect viral encephalitis, you will start empiric treatment with acyclovir, a drug that specifically targets herpes viruses. But in the end, there are endless possibilities, numerous viruses that can cause both meningitis and encephalitis, and they can all lead to a similar CSF profile. You will typically find anywhere between a few dozen to, let's say, a couple thousand cells, most of which will be lymphocytes. By most, I mean well over 80%. In many cases, well over 95%. Now, in your textbooks, you might find that very early in the course of illness, in the first 12 to 24 hours, this doesn't have to be all that clear, and there can be a significant percentage of neutrophils, and yes, in some cases it can be possible, but in my opinion it would be best for you to forget about that. If you are not a specialist in that field, if you find a significant percentage of neutrophils, you should be very careful about calling this CNS infection viral. You should consider other causes and you should consult a specialist. Now, as opposed to bacterial meningitis, glucose concentration in the CSF in viral meningitis or encephalitis or any kind of infection should be perfectly normal. Please remember this. And again, if you see abnormally low glucose, especially if it's below 40% of blood glucose concentration, this is a red flag. This is not viral as far as you're concerned. You should suspect pathogens like TB, fungi like Cryptococcus, and even bacteria like the good old Listeria once again, right? So be careful, very, very careful if you see abnormally low glucose. And this is especially relevant if your patient is immunocompromised or if they presented with a protracted course of illness, so with subacute prolonged course of illness. And this is typical for immunocompromised patients. Oftentimes they will present with deceptively mild symptoms in the beginning, like low-grade fever or a weak headache, seemingly insignificant, but then you will notice that their symptoms are not showing signs of improvement after a week or so, and instead they're actually getting worse. If you see this, even if it's not that impressive, this should be a red flag for you. You should suspect one of these pathogens, fungi, TB, something like that, if you're dealing with an immunocompromised patient. And speaking of immunodeficiency, there is one cause of acquired immunodeficiency, right, that you should never miss, and this is, of course, HIV infection. HIV itself, the virus, can cause viral encephalitis or meningitis, but more importantly, it opens a gateway to all sorts of infections that you wouldn't even consider in an immunocompetent patient. And this is why many experts recommend that every patient with a central nervous system infection should be tested for HIV and syphilis. So, immunodeficiency, protracted course of illness, in addition to abnormally low glucose, these are red flags that you should never miss. Now, besides glucose, there is another parameter of the CSF analysis that might help you, and this is lactate. You will find that it doesn't get mentioned all that much in older textbooks, but it's been gaining popularity in the last decade or so because several studies have shown it to be a very useful, sensitive, and specific marker of bacterial meningitis. Now, just like in septic shock, lactate is a marker of poor tissue perfusion and anaerobic metabolism. So when you think about it, it makes sense that it would be elevated in a violent inflammatory condition like bacterial meningitis. In the end, I would like to say that there are endless conditions, endless inflammatory diseases that can lead to all sorts of abnormalities in the CSF, especially elevated lymphocytes with or without abnormally low glucose like syphilis or central nervous system Lyme disease, autoimmune and paraneoplastic encephalitis. But these conditions will require highly specialized diagnostic tools that might not be widely available, so you cannot expect to be able to diagnose them with certainty right away. But the point is, you don't have to. If you pay attention to the things we covered in this lecture, and if you follow the simple tips I listed here, you will be able to realize that you are dealing with something out of the ordinary. You will simply start empiric therapy for the condition that is most urgent and most probable, and you will refer your patient to a specialized center. And that is all you need to do. This is more than enough. Just remember that, as with any other diagnostic test, CSF analysis should be interpreted in conjunction with the clinical presentation. And this is why I recommend that you take a look at my video on the symptoms of aseptic meningitis, bacterial meningitis, and encephalitis. It will help you a lot. And if you want to learn how to suspect serious conditions as early as possible, like sepsis and CNS infections, I recommend that you take a look at my free online course. The link is right there in the description. Thank you for watching, good luck out there, and take care.